Have you, as a parent or guardian, taken your child for a school readiness assessment to determine if your child is school ready? What is a school readiness assessment and why do schools need them? Hello and welcome. I'm your host, Dr. Mosam Tombene, and signing with us today is Samora Mbuyazi, and the feeder interpreter is Tulofelo Sikhatri. On Vital Signs, we'll focus on school readiness and health. Coming up on the program, producer Wandile Mofokeng spoke to a therapy director at the principal at the Center for Autism Research and Education on how occupational therapists can help children with regards to school readiness. We'll listen to an insert produced by reporter Lwando Nomoyi about the struggles parents with children living with autism face in the Eastern Cape. We'll speak to clinical psychologists about what to look out for in order to determine if your child is school ready, and we'll speak to integrated school health program manager from the National Department of Health about school health and the challenges that the department faces. Do remember that you can be part of the show today by asking the guests that we'll have on any question that you have on your mind. Simply share your view with what we're discussing. The number to call is 011-714-0677 or 011-714-0678. Also available on social media. Get tweeting away at Twitter. It is at SABC Vital Signs, or Facebook, SABC Vital Signs. The show continues after this ad break. Stay with us. Welcome back to Vital Signs. Namhlanje show wethu sikhuluma ngokusiza abantwana ukuthi babe ready ukuthi mababuyele esikolweni yonke into yabo icheckwe kahle. Ku-insert yethu yokuqala namhlanje, we're going to look at occupational therapy. Now, occupational therapy is basically the study and, of course, the career that a lot of people take up where they go out to assist people with their physical as well as occupational needs they may need from a varying number of diseases and, of course, ailments that have them requiring those needs. Now, this insert, of course, will have a look at what you need to look out for as a parent in order for you to be able to see any issues that your child may have. Let's take a look.
Please briefly explain to us, what does an occupational therapist do when it comes to assessing kids or with regards to school readiness? What does an OT do?
When we're working with children, we look at where they should be developmentally, and that encompasses a whole lot of areas. So you're looking at not only physical, being your fine and gross motor areas, you're looking at social, you're looking at emotional. Importantly, you're looking at sensory processing or the sensory systems. And one of the most important areas is play. So we're looking at the play of children. So occupational therapists deal in all of these areas so that children are able to access all their daily activities.
What is it that you as an OT do, or what do you recommend that mothers need to do when you see that a child is not fully developing at whatever age they are at?
If you find that they delayed in certain areas, or if there's a warning bell that goes off, moms have very good intuition. If they're worried that there's something that doesn't seem right, it should be first approaching the teacher if they're at a school. And if they're not at a school, approaching the caregiver of the child, whoever they spend the most amount of time with, and then seeing if they need a little bit extra support or should they go further. So further being, should they approach therapists either in private capacity or at the clinics or at the hospitals, or should they go for a neurodevelopmental assessment?
Now, after assessing a child or maybe seeing that a child has a certain mental health condition, maybe your ADHD or any other illnesses relating to mental health, do you think it's wise for parents to look at other options when it comes to placing their kids in schools? Or is a traditional school okay and the kids will develop as time goes?
Yes, traditional schools are wonderful for a large proportion of the community, and we try to be as inclusive as possible. Sometimes it means that they need extra lessons from the teacher. Sometimes it may mean that they need therapeutic intervention after school or within the school. So that being a psychologist, an OT, a speech therapist, or a remedial therapist. And then the final level would be, if they're not coping with the level of support at school, what would be the next level. So there we would go to looking at remedial schooling, which would be your full curriculum, but with extra support.
What would your advice be to parents or guardians who have their kids already placed in school? What is it that they need to look out for in order for them to identify certain missing aspects in their child's development?
If a parent is worried, go to your clinic, go to your local hospital, go and ask, go and speak up and say, I'm worried about my child. Sometimes you will be brushed off or sent on to another source. Keep asking those questions. If you feel your child isn't meeting the milestones, keep asking the questions, keep pushing, keep asking the school for more suggestions, and get the support for your child so that they can thrive.
After the break, we'll speak to clinical psychologist Julia Mathabate about what to look out for in order to determine if your child is school ready. Stay with us. Welcome back to Vital Signs. Now, for many learners, learning disorders and other disabilities make traditional education difficult, causing them to seek refuge at special needs schools and other institutions. Now, special needs schools are founded to help students with behavioral problems, learning disabilities, and sometimes physical disabilities to get a quality education. So some parents may wonder what makes a special needs school different from traditional schools. So to help us understand this, we're joined by clinical psychologist Julia Mathabate. Thank you, Julia, for joining us. I think before we get into things, I think the big topic that we're discussing today is around the idea of school readiness. So what does school readiness mean to you?
Good morning, Dr. Musa and the viewers. So as a clinical psychologist with special interest of working with children, my scope of practice would include diagnosing, treating, and perhaps referring. So in terms of school readiness, mostly my focus would be on the behavioral aspect of the child as well as the emotional aspect of the child. Is this child ready emotionally for grade 1, for instance, at age 7? And that would require quite a few questionnaires, a few questions, collateral from the caregiver in terms of how the child behaves, the temperament of a child, for instance, when they were still younger, and like a lot of background history in terms of the child's milestones.
What does readiness look like from a community perspective? Now, I mean, you're a clinical psychologist, so you would get patients being referred to you and you'd run through your checklist to make sure, you know, that they're emotionally ready, socially ready, and so on and so forth. But what does that look like from a community perspective? What does school readiness, have to look like to the everyday person as, you know, the 6-year-old becomes a 7-year-old and gets ready for school?
Yeah. So how do you mean from a clinical perspective view or from just anyone in terms of maybe a parent? What does a parent think?
From a parent's perspective, yes.
Well, okay. So generally we would look at things like how was the child coping at creche, for instance. Small tasks, tasks such as tying the knot, which would be work from such as the OT, for instance. Is this child able to take instructions? When I'm at home with my child and you speak of colors, for instance, can the child identify colors? Emotionally, when we talk about things, even at that age, which would be age appropriate, does my child throw tantrums? Can they wait for their turn when we speak about something, or they want something, they want it now, for instance? Are their sleeping patterns okay? Are their appetite okay? Such things. So parents holistically would look at a child in terms of, is my child ready? Can I trust my child emotionally, behaviorally, and with social skills to go out to a different context, a different environment from home compared to home?
Now, we speak about development as this big dome that a lot of people need to find themselves, ready for or reach certain stages in order for us to determine that the child is ready for school. What are the big ones that parents need to look out for in order to say that the child is fully developed?
Yeah. So again, I'll come back to my scope of practice, which would include the emotional state and the behavioral state.
Okay.
Because, for instance, say if a child emotionally is not in a good space, and all these days children do really experience emotional difficulties at what, it doesn't matter the age, even in grade 1. So we would check, for instance, things like separation anxiety. When, say, mommy has to go away for work reasons, or daddy has to go away for work reasons, or mommy has errands to run, is my child, can they withstand the separation anxiety, for instance? Can I negotiate with my child to say, I'm going somewhere and I'll be back, without my child throwing a tantrum? And that goes back to the relationship, obviously, between the caregiver and the child. So it's such things in terms of emotionally, where is my child at? When, for instance, they don't want certain type of food, when they don't want to eat a certain type of food, or they are full, they don't feel like eating, can I have a sit down with my child, even at age 6 or 7, and negotiate the importance of eating, the benefits of eating, and so forth? And I reiterate the fact that it will, of course, be age appropriate. So those are certain things emotionally and behaviorally, like I mentioned. Does my child listen to instructions? Does my child respect, things like thank yous and may I please, for instance. And those are things that we learn from the home environment. So as parents, if that is the foundation is on a good start, then we can safely say we can trust our kids at school with the educator there.
How do parents build that relationship and, be able to build the trust and build the development that we require in order to say that the child is school ready?
And that is one of the most important aspects that I try to psychoeducate parents on. The importance of the role of the primary caregiver in the child's life. When we refer to those attachment theories and whatnot in psychology, the consistency in parenting, the consistency in caregiving, allowing a child to explore their environment at whatever age. However, the consistency in the discipline and the supervision of the child will play a role. Hence, it becomes a build-up, from grade 1 to grade 2, some even from creche. Then we go into high school, later on into varsity, adulthood, and all of that. So the relationship between a caregiver and a child plays a really, really important role, which could later on develop into other things once the child turns 18. So we really, really plead with the caregivers to sort of follow up, those check-ins, constant check-ins. How was creche today? Who did you play with? How was your lunch? Teacher, whoever, where was she or where was he today? General checkups emotionally with the child. It teaches the child that, well, my emotions are important. How I feel is important. Then that becomes something that is now a routine at home. Whereby constantly we check up on each other in terms of how we're feeling, not only how do we look on the outside. So it gives us now a different perspective of ourselves as children that, there's something like emotions. So it's okay, it's understandable when someone asks me, how's my day today? I don't have to say, I'm okay or I'm fine or whatever. Labeling emotions, I'm happy, I'm sad, I'm frustrated. All of those. So the relationship between a child and the caregiver is really important throughout different milestones of a child.
Now, once a deficit has been recognized either by a teacher, a parent, or someone like you, a clinical psychologist, what are the next steps? What happens to a child, for instance, that has these deficits?
For instance, our role as clinical psychologists would be in most cases, the occupational therapist would have seen the child, the educational psychologist would have seen the child, and now the child is in school, and obviously now the relationship between the educator and the caregiver is quite important. That's where the collateral comes from. That's how the parent or the caregiver learns more about their children at school, right? So, for instance, the educator would now speak to the caregiver, and in terms of all the behavior or the emotional difficulties, which would be the symptoms that the teacher would have seen. Now my role would be to assess, clinically, according to my scope, in terms of listening to the caregiver, obviously, and not undermining the referral from the educator, for instance, because now that is really important. So my role would be to assess the child from the clinical psychologist point of view in terms of the behavior and the emotion, and obviously, like I mentioned, the collateral from the caregiver will give me a clearer picture of where the child is at. And say, for instance, there are those symptoms of behavior or emotions, and we need to be aware that in most cases the learning difficulties will overlap and somehow create an onset for behavioral issues or emotional issues, or vice versa. So one of the three can cause the other, or behavioral issues can create an onset of learning difficulties. So once we get the focal area, what are we dealing with? What is the child struggling with the most? Is it more emotions? Is this child possibly depressed? Is the mood too? Is he or she mostly too sad to a point that it's now affecting their academics? So now we actually realize through the intake and all the collateral from the caregiver, we actually find out as psychologists that this is the underlying concern that we have. And in most cases, as soon as we work through the depression, for instance, then the child's academics automatically improves. In some instances, we may require the intervention of a specialist psychiatrist to help us with medication. So it becomes a multidisciplinary team effort.
Well, we've got Kiseng on the line from Gauteng. As always, we always encourage you to call in so you can ask the guests that we have on any question that you have in your mind. Good day, Kiseng.
Hello.
Hi, Legai. Re teng mama, re mametse potso ke eng?
Potso ke gore ke na le ngwana wa ke foster, o na le 5 years, and then o go grade R. Ha khona kwala wa scratch like, and then ha mo khalemela ha utlwi. And then mara ha shebile di Popeye wa concentrate like, and then the color what he eats, but not like that. But he can remember some of the things more TV. Mari so naughty. Kore how much o ka re mo etsa worse.
Okay, Kiseng. Thank you, mama. I think re utlwile potso gore e reng ke tla isa o psychologist ya rona gore a answer re mohlomong bothata ke eng, okay? All right, ma'am. All right, so you heard the question there, this idea that there is a foster child that she looks after and the child isn't really meeting up with where the rest of the classmates would be, isn't writing or rather scratching, but in the same breath is able to focus vividly when, they're watching a TV show and things such as that. Is this something that you see commonly?
Yes, I do. And generally, I think with children, even when they are coping appropriately regarding as their peers, compared to their peers regarding their age, even with children with no special interests or children who are not struggling academically or at creche or whatever, I think it's a general sense that children have that they will mostly focus on things that they like. For instance, they will like a certain cartoons, for instance, certain music, certain games on their gadgets. So I think that, however, now when we look at what Mama was now explaining, in a sense that the child has it's like he or she is struggling with instructions compared to his or her peers. She's a bit delayed. And it's like the temperament generally, he or she is quite not so happy child. I don't want to use this word aggressive, but all I can say is that the discipline, as parents, as caregivers, as soon as we realize that we're raising a child with possible special needs, unfortunately, as caregivers, that's where we need to be most patient, because chances are this child already feels misunderstood, because he or she is not understanding himself or herself already, based on the pressure from the society. Even at 5, they can sort of see what they're struggling with, what they're not struggling with compared to their peers. So it's quite difficult when you have a certain weakness or shortcomings, and now the society feels like it's adding more pressure. And again, I empathize with the caregivers because most of the time the caregivers wouldn't understand, hence the style of discipline. But the discipline sometimes, if it's too punitive, it actually perpetuates the issue. Because now I think every human being, doesn't matter their age, when they feel not treated well, they will retaliate. Every person, when you feel attacked, you'll try to defend yourself.
Yes.
So, for instance, with
Julia, unfortunately, I'm going to have to jump in there, but because we continue our conversation a little bit later on, I think we can finish off the rest of Mam Kiseng's, answer so that, she gets a better understanding of what to do with the child, where to go, and of course, the follow-up that that child would need. All right, Julia and I will continue with this discussion a little bit later on. But after the break, of course, we'll speak to Integrated School Health Program Manager from the National Department of Health, Feni Motwane, about the health or the school's health and the challenges that the department faces. Stay with us. Back to Vital Signs. Our government has pledged to put the health of school children first by rolling out the school health screening programs. Now, these programs are set to bring a basic health screening to learners at schools in areas that have been identified as priority health districts. Now, these include schools in areas least likely to have access to healthcare services. And to speak to us more about the school health and the challenges that they face, we're joined by Integrated School Health Program Manager from the National Department of Health, Ms. Feni Motwane. Good day, ma'am. Thank you so much for joining us.
Good day, Dr. Musa, and thank you for having us.
Good. So let's look at the problems before we look at the solutions that you've come up with. What have you identified as the big issues that we find within school-going children?
In terms of the screening, the main challenge there is the issue of vision, whereby when learners are screened, nurses will then identify the need for having spectacles. The issue of dental caries, whereby your oral hygienist and dental therapist will have to go in, then apply the fissure sealant. And if there's also a need for tooth extraction, then they will be referred to the nearest health facilities, but because no invasive procedures are done in schools. But besides all this, the main challenge is with parents and caregivers who don't sign consent forms for the school health nurses to then offer these services to the needy learners.
Now, the big thing that a lot of people always discuss is this idea that, it's the child goes to school from, let's say, 7 o'clock, they come back at 1 o'clock. As a parent, you are also busy at work, so you never really get time to take your child to a clinic if they're sick and things such as that. And that's why I'm assuming you introduced the school health program in order to assess and do those basic screenings so that the big conditions are taken care of. But in terms of looking at that, what has your uptake been like? I know you've mentioned consent being a big one where, parents don't sign the consent letter to say that the children can get these tests done. But what other things have you identified?
The uptake is quite good, I must say. It's only in few areas where you find parents not signing the consent forms. However, we have the health promotion teams, the social mobilization teams, and even from schools, you have your learner support agents who also then encourage learners to also ensure that parents and caregivers receive these consent forms. And then when they are returned back, then the learners can access the services. So in terms of the access, generally because the program is implemented across, the country and in all the schools, because they are targeting, specific grades like your grade 1s and, grade Rs and 1 in your foundation phase. Intermediate phase is the grade 4s. The grade 8s in the senior and phases, and grade 10 in the further education training. So the uptake is quite good, I must say.
Now, you've mentioned that different grades are also getting checked. What specifically do you look for? I know you've mentioned the caries, but are there different things that you'd look for in the older children versus the younger ones?
In the older children, we also assess them for psychosocial, needs and support. So we administer what we call is the Strength and Difficulty Questionnaire. It's a self-assessment a tool where we give them to complete. And thereafter, the school health nurses will then analyze the answers and then classify them if they need, psychosocial support, and then referral, to your social development for further management. And I must say at this stage that the Department of Social Development is also on board to provide that psychosocial support.
Mm-hmm. Now, an important thing that I think you've highlighted is this idea that, different problems exist for different groups. And like you've mentioned, for the older kids, they get the psychosocial assessment that would need to be done as well versus the younger kids. What happens when you identify issues that the school nurses, pick out and see that these are the issues, but are heavier issues? So let's say these kids have got congenital heart problems and have breathing problems and things such as that. What's the next step after an issue has been identified?
Okay, thanks for that. Maybe I must indicate that, the package that the school health nurses takes to school start with health education.
Okay.
According to the age groups. For the minor ones or small ones, it will be your toothbrushing, your hand washing, self-care, and also assessment for minor ailments. And then the second step, then it will be screening, like I indicated, and even management, on-site management. So the school health nurses is the primary healthcare nurses that are trained, to prescribe and even give on-site medication, including the school vaccinations. So if complications are picked up, these learners are then referred for further management either in the nearest primary healthcare services or your hospitals. And we also urge parents then, when they receive these referral letters, to at least make time and take the learners to those facilities for further management. But furthermore, we also have your community healthcare workers or your ward-based outreach teams that visit households. And if they come into contact, with these letters or the referral letters in a household, they also make means that these learners finally reach, the primary healthcare facilities to access the services that they are referred for.
Now, an important thing that you just mentioned is the idea of vaccines. And we know that the measles outbreak is currently problematic in South Africa, with a number of provinces reporting cases. Is there something that's being done that will bring the measles outbreak and the vaccination campaigns that exist there together with the screening programs that you have for children now?
Yes, of course. Maybe let me start by indicating that in the 2023, the national measles vaccination campaign was planned and is still going to take place from the 6th of February up to the 17th. But then in view of the measles outbreak that has been experienced since October last year and has affected at least 5 provinces, there's been measles outbreak responses whereby all children under 15 years were vaccinated, especially those who were contacts, to children with confirmed measles cases, in view of preventing the spread, of the measles, because we know that it's highly infectious. So those provinces are basically wrapping up the measles outbreak response. Then from the 6th of February, like I indicated, then the national measles vaccination campaign will start. And as a matter of fact, since then, it's extended to your learners or children under 15 years. It will be taken to schools. We've got that agreement already with the basic education, and it will also overlap with our annual human papilloma virus vaccination program for grade 5 girls, which will then start from the 20th of February up to the 31st of March.
Now, a lot of dates that you've mentioned to us with a lot of campaigns. So it sounds like you guys have a very, very tough time ahead of you. But of course, you're doing it to make sure that all the kids are vaccinated, all the kids are looked after, and that you're able to do what you can. We've got Tabisile now on the line. Good day, Tabisile.
Good day, Dr. Musa.
Yes. How can you guys
I'd like to know that if I have a child, my child is 5 years old, and I'm seeing some autistic kind of behavior from him, and I don't see, I haven't been diagnosed. He hasn't been diagnosed with it, but I have already saw the signs. So I want to know if the school programs will be able to see that and help me with that so I can do anything with it. Because I don't have any money for taking him to proper something like medical, what you call,
we understand, Tabzil. I think we get your question. So I'll forward that question through so that we get an answer for that, okay?
All right, thank you.
All right.
Sir.
So, Mom, and I think this is a situation for a lot of people when they discuss, having identified issues with their children, whether it's autism, whether it's behavioral problems, whatever it might be, is that they notice that something isn't necessarily right with the child, but what then happens then on? So in your screening program, do you have a behavioral or a mental health or a autism screening that goes into the nurses looking to see if the children have any issues so that when they are identified, they're able to be taken to higher centers for referral?
Maybe let me start by responding to the question to encourage mom and other parents and caregivers to develop this health-seeking behavior. They should not wait, for such programs, but then take the kids to the nearest health facilities. The primary health care facilities are free, and these are available mainly in most, communities and areas. But coming back to your question, Dr. Musa, with regards to the screening of learners, of course, I've indicated our school health nurses are trained in primary health care, so they are able to assess and pick up all sorts of behavioral issues, that needs attention. And of course, because they've got a whole lot of schools that they need to visit, such behaviors are then referred, appropriately to the primary health care or even hospitals for further management.
Well, thank you so much for joining us and answering that question. And Tabisile, at home, if you're not winning in terms of, if you're waiting for the school program to come around to the creche where your child is, if that's not happening, go to your local clinic. If you're not winning at that local clinic, take it to the next level and the next level and the next level until your child is assessed. Like you mentioned that, a lot of the time people don't have the funds to take the child to clinical psychologists, to take them to all these big programs and get assessed. So what you can do is be persistent in everything that you do to make sure that your child gets the help that they need. Thank you so much for joining us. That was Integrated School Health Program Manager from the National Department of Health, Ms. Feni Motswane. After the break, we continue our discussion with clinical psychologist Julia Mathabate about the school readiness and why some kids find themselves struggling in class. Stay with us. Welcome back to Vital Science. Now, with scores of learners from coastal schools reopening for the 2023 academic year, parents and children living with autism say that they continue to face many challenges. They complain about the lack of access to proper schools and the never-ending waiting list that some children are subjected to every single year. The Eastern Cape has over 80 learners with autism spectrum disorder, and SABC's Lwando Nomoyi reports.
Many children living with autism often face a tough future. Access to schools and a shortage of resources remain key challenges for them and their parents. 13-year-old Agahlulwa Xindo has been sent from pillar to post for the past 5 years in search of a school. His 55-year-old grandmother, Lwando Mofokeng, resorted to homeschooling him. Civil rights organization Autism Matters says the lack of attention and support given to children living with autism is a violation of their constitutional rights.
We need schools that will be allocated in our districts, in our communities, like the mainstream schools. And we feel that our children are not prioritized, according to their what you call the White Paper 6, according also to the Children's Charter and the Constitution of the country. We think that our leaders have forgotten so much, and whatever that they are doing is really not enough.
The Department of Education in the province says plans are in place to build more schools and appoint specialists in the teaching and learning of children living with autism.
autism is not one of those problems that parents will stay with their kids in homesteads, but equally try to make sure that public best does respond to that, because you would remember that this is only an area that has been always provided by the private sector, and with a huge amount of payments that parents are subjected to. So we were then saying, no, we need our own dispensation of schools that deals with barriers in learning, so that government can cushion those parents that have got, unfortunately, learners with barrier. Part of that is autism, and mild and excessive one, but also look into building hostels.
According to a recent study conducted by Health E-News, approximately 2% of South Africa's population is affected by autism. Lwando Nomoyi, SABC News, Gqeberha.
How do you know if your child needs a psychoeducational assessment? Often educators are the first to suggest psychoeducational assessments for the child, and this is often based on the observations that happen within a classroom. Now, behavioral challenges such as lack of attention, poor concentration, of course, avoidance of academic tasks may indicate that your child is struggling with the demands of the classroom situation. Now, we still have clinical psychologist Julia Mathabate, who is joining us to give us a sense of, why some kids find themselves struggling in class. Thank you once again for joining us. I think, before we continue our discussion, before we went to ad break about 2 segments ago, we're looking at this idea of how to answer the question. I think that was set up for one of the callers. So you can continue on that, please.
Yes, no, I think I was about to conclude in a sense that the discipline, as I was saying, that I empathize with the parents regarding the frustration. It's not every day that we, parents get to deal with or have to graze a child with special needs. However, the manner in which the caregiver will discipline the child also may actually aggravate the child's behavior. So if we try to be more empathetic as parents and caregivers and all of that, give the child support and try to work together, I think we can.
All right. I think we seem to be having an issue with the connection from Julia, but that, of course, was based on the question that the caller came in a bit earlier on to give us, where she had a 5-year-old child that she was looking after and found that the child was not listening, misbehaving, and, of course, was finding it difficult to manage the child. And then, of course, we're looking at how to answer this question. What do parents do at home when they do identify that an issue has arisen within the child? What are the steps they're, going forward? Now, I think we continue with Julia now, as she is back. Julia, welcome back. And of course, let's look at what common problems you find being referred to you. Now, the question that lies behind this, of course, is a lot of the time the parents don't necessarily see that the child has got an issue. Parents have got a job that they go to throughout the day, and the child is either at creche or they've just started the early learning stages of their life. And in class, the observer is the educator who sees that the child isn't able to focus, who sees that the child is misbehaving, and so on and so forth. So what are the big things that get referred to you?
So yes, and thank you, Dr. Moso, for highlighting that the team becomes between or amongst the educator, the parent, or the caregiver, and the child, right? So the biggest relationship would be between the educator and the caregiver. So, for instance, if there is a complaint, or maybe on the child's homework book, that the child is inattentive today, homework not done, and all of that, and the parents or the caregiver is requested to go to the school, I humbly request and plead with the parents to try to follow that up. Because remember, educators know our children more. They are the people who care for our children throughout the day in our absence. But the second part of your question would be, most of the referrals that I receive would be the inattention, the disruption in class, poor concentration, inability to follow instructions, not waiting for their turn, which could be possible ADHD, attention deficit hyperactivity disorder. Some could be the autism spectrum that has been spoken about earlier on. And in most cases, there is a mood component. There is possible depressive symptoms, which may be suggestive of possible depression that the child could be experiencing. But the number one on the list mostly is ADHD.
Mm-hmm. Now, we've got Adelina on the line as we continue our quest to hear what questions you have in your mind as we look at this very important question that we're asking today, and that is your child ready for school? Adelina, good morning.
Hello, how are you?
We're well. How are you?
I'm fine.
Good.
I speak to Adelina from First Aid.
Mm-hmm.
I want to know about my baby. She's 17 years old. But she don't like to read. She has a bad behavior, especially when it comes to the parents. When I ask her to read the books and everything, but every time she like to go to the street, she don't want to concentrate at the school programs. So I don't know what can I do.
We don't want to know what ma'am.
17 years.
When I'm 17, ukena school grade, ma'am.
Grade 10.
Grade 10. All right, ma'am. Re tla utlwa re bothata re nka bolukisa rang, okay?
Okay, Papa.
All right, thank you. So the big issue is, I think what we could chalk this up to and ask the bigger question is diagnoses that are missed or children that are not recognized early enough. So we have this continuing problem where kids, for instance, in the schooling system are just condoned to pass so that, they pushed out the school system, but they're not necessarily performing well. How do we look after an older child that has got learning difficulties, has possibly had learning difficulties for quite some time?
And again, it is possible that this child started declining academically, say maybe in grade 8 or grade 10. It's very possible that they were academically progressing well. Right now, in terms of the misdiagnosis, that's where now the parent and the teacher, their relationship has to be looked at, because, for instance, if there is a relationship between the educator and the parent, then there would be those loopholes, those signs, the complaints from the teacher regularly of, hopefully, from the teacher to the parent. And how does the parent receive that? So without trying to blame any of the system, the parental or the school system, the relationship between the parent and the educator is really important, because now the parent is not the educator. They wouldn't really know when the child is struggling. However, if the educator takes the initiative and includes the caregiver and informs them, it depends also on what does the caregiver do regarding that. But as soon as there is a plan in place and say a child sees a psychologist or an occupational therapist or an educational therapist, that's when intervention can really start.
Now, let's talk about intervention. As a clinical psychologist, you get a number of referrals for autism, for learning disorders that may come about, sometimes even physical disorders that come about. What is your role in treating these patients?
As I mentioned, my focus would be on the emotional, behavioral, and obviously the social part of the child. The important part that I'd like to mention this morning is, the concept of care for the caregivers. I mostly encourage parents to also try to get therapeutic intervention, psychoeducation, a space to vent. Yes, I understand in most of our public sectors is almost impossible, but if we try, there can be, to a point where we can see social workers or psychologists or whatever. Because if the parent understands, they have insight in terms of what's going on with their child, it becomes easier for the child to cope, right? So even if, say, I would help the child, I would treat the child, I would have therapy, the child would follow up, the caregiver would bring the child for regular follow-ups, and I'm speaking both in public and in public sectors. The child will follow up with therapy. The most important part is the environment that the child goes back to. So the more educated the parent, the more, the change will be. As I always say, a happy parent equals a happy child. So it becomes a holistic approach towards the child.
Now, a lot of children that then go on to get some sort of diagnosis within, the special needs, or, they're either autistic or ADHD or whatever it might be, end up getting that diagnosis due to a number of things. So who makes the decision for a child to either get the diagnosis or to either go to a special school or go for remedial classes and things such as that?
Yeah. So as I mentioned, in most cases, it would be a multidisciplinary teamwork. We would have a child psychiatrist, for instance, who will also diagnose. The clinical psychologist also can diagnose in terms of what the child is struggling with. So the psychiatrist will mostly help us with medication in terms of, say, it's an ADHD diagnosis. The psychiatrist will help us with medication to help the child's behavioral, to regulate the child's behavior through medication, whilst on the other hand, the psychologist will continue with therapy for the child, in terms of the check-ins I spoke about. Where are we? How are you feeling? Since this process started, are we getting better? Are there other stresses that we need to look into apart from this psychiatric diagnosis that we have? So in most cases, it would be the psychologist and the psychiatrist working together.
Now, very quickly, I'm going to need you to just give us quick tips that parents can use to identify children that have ADHD and autism. You have about 30 seconds if you can.
So it goes back to the relationship between the child and the caregiver. If you know your child well, you'll see certain loopholes quicker than anybody else. The consistency in caregiving, understanding your child from birth, hopefully under ideal circumstances. But for me, Dr. Musa, it goes back to the relationship between a caregiver and a child, because ultimately caregivers know their kids more.
Well, thank you so much for joining us today and answering all the questions that were posed to you. Of course, looking at all the things you need to look out for as your child gets ready for school. Is your child ready for school? And what assessments have you personally done for your child, or if you're a guardian to someone else's child, to make sure that they are not falling within the cracks, that their deficits are identified very early and you're able to help them out as quickly as you can. Know the relationship that you have with your child, with your niece, with the child next door, so that you're able to identify any issues that they may have that will benefit their futures. Thank you to all the guests for coming in and joining us today as we looked at school readiness and the health that will require the kids to be at that point in time. Good luck to all the children as they start the schooling year, and we wish you well and health along the way. From the Vital Signs team, thank you very much. See you again next week.